So lab testing, image testing, it's always frustrating when you go to your physician and they deny. They say, no, this is not appropriate. We're not going to order this MRI study. We're not going to order this lab test. Now, it's important for you to know as a healthcare consumer in the US, you can go to pretty much any lab and request your own blood tests. You can go to any radiology center or imaging center and you can ask to have an MRI done. The important thing to ask yourself is if that's a good thing to do. So, welcome to Dr. Ashori. My name is Dr. Mohammed Ashori. I'm a board-certified family medicine physician practicing in the US, in California, and this channel is all about healthy aging. And as we navigate the healthcare system, there are important things for us to know, tools that we can use to help ourselves achieve our ultimate health goal. So, as I mentioned, you might have gone to multiple specialists, to your primary care doctor, and for whatever reason they said, nope, this MRI is not appropriate, this PET scan, this particular blood test is not appropriate. In this day and age, in the US, you can walk into LabCorp, Quest, any imaging center. There's lots of independent imaging centers, and you can request your own test. And as long as you're paying cash for these tests, not only would these be a lot cheaper than if you paid with insurance, but you simply don't need another doctor's prescription. The facility themselves is going to provide the prescription for you. And while this can be a great asset when you really are stuck somewhere and you know you need a particular test that for whatever reason is not being approved, the downside with it is that more information in healthcare often leads to more misdiagnoses and excess diagnoses. So this is kind of the false positive effect that we talk about in healthcare. You might be sitting there and waiting for this one particular MRI because you really want to know what is going on in your knee, what is going on in your brain. The worst thing that can happen sometimes is that we do find something abnormal on this imaging study. And now we anchor to that one abnormal finding, and then we confuse the entire health picture of the patient. And we just say, okay, well, that's exactly what's going on with the knee. That's what we're going to focus on. When in fact, the pain or the issues were being caused by something completely different that just doesn't show up well in an MRI study. In fact, one of the best physicians, the physicians who are really good at what they do, they know when not to reach for a test, a blood test, or an imaging study, or any other kind of study, or even resort to surgery, because they know that sometimes it muddies the waters, it complicates the picture for the patient, and it leads to these false positive diagnoses that the patient will carry around with them forever. Classic examples are somebody gets diagnosed with lupus when they really don't have lupus. They just had a little bit of an elevated ANA. Somebody's misdiagnosed with hypertension, high blood pressure. They're on blood pressure medicine when in fact they didn't have high blood pressure. They had episodic high blood pressure, and now for life they have to be monitored and they have to take these medications. And there are many such diagnoses out there. The way I try to explain it to my health coaching clients is use this 3-point model as a framework to make a decision as to whether you should or shouldn't pursue extra testing on your own, or even convincing your physicians to do so. So the number one is, based on this information that you might find from this test, what exact steps or actions would you take? And are they different than what you should be doing right now? Back to the example of the knee, if you get the MRI and it shows a meniscus tear, would you opt to have a meniscectomy? If not, if you're not willing to undergo surgery, then the best thing to do is probably to still undergo physical therapy, which is incredibly effective for most meniscus tears. Now, you might be in a different situation where if I get this MRI and I know I have a meniscus tear, I'm not going to participate in this particular sport. That makes sense. I think that is a good way to utilize that information. The next thing to ask yourself is, what is the actual risk to you if this was a false positive? Meaning you get the blood test, your cholesterol is really high, or your ANA, which is a marker for lupus, a screening marker for lupus, is elevated. And now you have this fear or worry that, oh my gosh, this is lupus, or I'm going to be at risk for a heart attack. And if if the risk of this potential false positive is that you're devastated and you develop a lot of anxiety, it may not be worth it to undergo this type of test. And the third one is whether this test, whether the outcome or the result of this imaging study or lab test is going to help you achieve your ultimate health goal. What is your ultimate health goal? Now, I've done some videos on that, which I'll link in the show description. Each one of us in this healthcare environment needs to know what our health goals are. What is it that's important to us? What is our definition of good health? And if this test is not going to get us closer to that, if it's just going to give us more tidbits of information, we're only going to experience information overload, which is going to be stressful. I hope this information is of value. If you've encountered such situations, share it with us below. Tell us your experience, whether positive or negative, and check out drashori.com. Take care.